In 2011, a national statistic determined that of the 25.8 million children and adults in the United States, 8.3% of the population have been diagnosed with juvenile onset or type 1 diabetes. With non-diabetic individuals, when you eat, your body breaks down your food into simpler forms such as glucose. The glucose goes into your bloodstream, where it travels to all the cells in your body. Your cells use glucose for energy. Do you know what insulin is? If you guessed hormone, you were right. Insulin is a hormone produced by the pancreas, which helps remove sugar or glucose from the bloodstream. In type 1 diabetes, the body does not produce insulin. Insulin is a hormone that is needed to convert sugar or glucose, starches, and other food into energy needed for daily life. Now that we know the basics of type 1 diabetes, let's look at a typical day in the life of a type 1 diabetic. We have learned that type 1 diabetic patients' pancreas no longer produces insulin. So how do they remove the glucose or blood sugar from the body? Through multiple daily injections with insulin pens, insulin syringes, or an insulin pump, while diligently monitoring their glucose levels by pricking their fingers and testing with a glucose meter. Sounds monotonous, doesn't it? Let's examine the consequences of discounting diligently monitoring and treating type 1 diabetes and sugar levels. Meet Jane Knight, triple amputee in danger of becoming a quadruple amputee, claiming that she could have avoided amputations had she taken blood sugar level monitoring and her diabetes seriously. Poorly managed diabetes leads to a multitude of severe consequences inclusive of nerve and limb damage or diabetic neuropathy, ultimately ending in loss of limbs. Other consequences result in, but certainly are not limited to, vision loss, kidney failure, loss of touch or feeling in fingers and toes, comatose, and death. Now that we have established what possible outcomes can be encountered when type 1 diabetes is not properly managed, let's take a look at what we need to do to improve diabetes with self-management. We all know that everyone benefits from regular physical activity in a variety of ways. According to the CDC, benefits of regular exercise include weight control, reduced risk of cardiovascular disease, reduced risk of type 2 diabetes and metabolic syndrome, reduced risk of some cancers, it strengthens bones and muscles, improved mental health and mood, improved sleep, and increased longevity. In addition to the CDC's list of benefits for the entire population, the American Diabetes Association suggests that a range of supplementary benefits are extended to those with diabetes, including lower blood sugar levels, improvement of insulin sensitivity, lowered A1C levels, decreased triglyceride levels, increased HDL cholesterol, and more. Always include a 5 to 10 minute stretching or warm-up phase. This will give your muscles the opportunity to get warm, to assist in the prevention of muscle tears, muscle pulls, cramps, and fractures. After the warm-up phase has been completed, the body is ready to go into an aerobic or cardiovascular state. During the aerobic phase, your body requires more oxygen. Your heart beats faster, and your lungs breathe deeper to deliver oxygen through your blood vessels to the muscles that require it. It is during this time that you should measure your max heart rate. When supplementing an exercise regimen with daily diabetes management, it is important that you also know associated risks, symptoms of hypoglycemia or low blood sugar, and how to prepare and perform during your workout. The first step in introducing a new workout regimen is deciding what workout is best for you. Physical activity that you find enjoyable and doesn't bore you will aid in the prevention of discontinuation, including elements of aerobic exercise such as walking, swimming, dancing, jogging, or cycling, and the strength and flexibility training such as weight lifting or yoga and Pilates will give you an overall complete workout. Accompanying an exercise diary with your new workout routine is beneficial in monitoring blood glucose. A weekly log that integrates the following: the type of activity, whether it be walking, swimming, or jogging, the duration or amount of time spent performing the exercise, blood glucose levels before, during, and after the exercise, and heart rate before and your max heart rate. You will also need an abundant amount of water, and you should keep between 10 to 15 grams of fast-acting carbohydrates on you in case you encounter a hypoglycemic episode. Examples of 10 to 15 grams of fast-acting carbohydrate include 1 individual Reese cup, 5 to 6 Lifesaver candies, 4 to 5 ounces of regular non-diet soda, 4 to 6 ounces of orange juice, 2 tablespoons of raisins, 8 ounces of non-fat or low-fat milk, 1 tube or 0.68 ounces of Cake Mate decorator gel, glucose tablets, glucose gels. Glucose tablets and glucose gels are better to have on you at all times as they are commercialized products and pre-measured to the appropriate 10 to 15 grams recommended for fast-acting carbohydrate in the event of a hypoglycemic episode.
My name is Tori Watt, and now we're going to talk about some of the precautions you have to take before you exercise. It is important to have something carb-worthy to lift your blood sugars, just in case you go low, such as glucose tablets, which are good to keep in the car, or bags or purses. There's also little icing packets that you can also keep in your car that just in case you were to faint, you could put into the person's cheeks and their cheeks absorb the carbs so that their blood sugar goes up. You can also bring little Juicy Juice boxes because you primarily want something that's 15 carbs, and that'll raise the blood sugar up nicely. You also need to check your blood sugar with a glucose monitor before exercising and after exercising, and before you go to bed to make sure that your blood sugar doesn't drop through the night. But right now we're going to do a demonstration on how to make your own 15 carb snack. So first we're going to put 4 ounces of milk because that's equivalent to 5 carbs. We have 3 strawberries, which is equivalent to 6 carbs. And then we have 1 ounce of a banana, which is equivalent to 4 carbs. And then we're just going to blend it all together. This is good to have even before exercising, just in case if you are going to be exercising intensely, because it's important to make sure that your blood sugar doesn't drop. If you're not exercising intensely, then you might want to just keep an eye on it while you're exercising and make sure that it doesn't drop. There's something called an unknown drop in blood sugars where you start to not feel when your blood sugar goes low. So it's a good idea to always check your blood sugar before you go to bed, and maybe just have something next to your bedside table just in case you are to drop low, so that way you have it there just in case. But it's really easy. You just need to be on top of it and keep track of what your blood sugars are and know what type of diabetic you are, and in order to be cautious of when your blood sugar could drop.